Hi, my name is Ashley Hope Dark. I am a labor and delivery nurse at Borges Hospital. I've been a nurse for 8 years, a lot of that which would be in long-term care facilities. I also did hospice, home care nursing, and then now my career, the last 3+ years, I've been in labor and delivery, recovery and postpartum.
So in your experience working in a nursing home as a nurse, what are some kind of end-of-life moments that you remember working with families that were maybe significant or handled well or handled poorly within?
So my biggest thing, I'll never forget, because I was a brand new RN, and it was like within the first probably 6 months I was on the floor, and her name was Bertha. I'll never forget her. She was very lively, and she was a square dancer, and she played cards all the time with her friend who would come from another facility. But the most important thing that I think I did for her and her family was I was able to call them in time. I was able to identify when it was getting close and then had them come and someone was there with her. I think that's one of the most important things for me personally, and I feel like when I reach that moment where I'm going to, slip away to the next world, I want somebody to be with us. We're humans. We love that human interaction. I think it's safe to say no one wants to die alone, so I think I found comfort in this sad situation with the fact that her family was around her and able to be there for her as she passed. So to me, I think that's one of the most important things we can do as a nurse. Is sometimes it's impossible to tell. Sometimes it just happens and there were no warning signs. But most of the time when they're in hospice, when you're administering like Roxanol and the liquid morphine, you kind of, that it's, their respiratory rate starts to slow, different clinical signs that you can identify, that that it's getting to be, towards the end. So really like notifying the family, knowing, is their family local? Is their family 2-3 hours away? And being able to, notify them in time and try and, have them be there. Sometimes you're a little, ahead of it, maybe 10-15 days, so they come into town, unfortunately, and then it doesn't happen for a while and they're kind of waiting around, and that's a really difficult time too, because you know the prognosis, what's going to happen, but you see this dynamic of like, when are they going to pass? And it's like, not that they want them to, but that it's going to happen, and someone's suffering too, so you want it to be sooner than later. And that might be difficult for some people to swallow and hear, but really as a nurse, that's kind of where you have to change your perspective on it and change your thinking, because this is going to happen no matter what. There's no saving someone from death. Like, that it's going to happen, so it's better, and that's where there's a lot of ethical dilemmas in there too, and I think it takes a special nurse, because some nurses feel really uncomfortable, giving that liquid morphine as much as it needs to be given. I see that can be an issue, but for me, so in that takes a special nurse to take care of those hospice patients within the facility, so I think that's a big deal, but being able to facilitate that. But yeah, I was able to get a hold of her family, and they were there for her, and I think that was one of my most proudest nurse moments. When you're a brand new nurse, half the time you feel like you don't know what you're doing, even though you know what you're doing, but what the book told you to do, but yeah, it's all these situations that you've never experienced that I was really happy. I felt like, okay, I'm going to be a good nurse, if I could do this right, I can do everything else, But I think that's one of the most important things, is being able to identify and have people there. And then there's been situations where they didn't have family. They literally had no kids. Their husband was gone. They're widowed, or a widower, and trying to sit next to them and find the time so that you're the person that is there when they pass. And that's happened a few times with me too, and just making sure that, sometimes I was a little late on my med pass because I was sitting with somebody, but it's okay. To me, it was worth it, So.
What have you encountered with funeral homes? Maybe a good instance of something you remember that really touched you as a nurse, and maybe something that you witnessed or were part of that was not as great.
So really I've had nothing but positive experiences. Everyone has been so kind and patient, and that's one of the biggest things too, is sometimes when they get there, it takes a little bit to coordinate, and everyone has always been very patient with us, especially getting all the paperwork. That's the hardest part. Yeah. But it's actually been fairly simple within the nursing home setting, the paperwork that you have versus like the demise setting in labor and delivery. There's a lot more paperwork for that, probably like 10 times more. So that's a nice thing that usually goes a lot more smoother. But I guess one of the things, and sometimes it's just hard to avoid in the nursing home setting, is people will die during the day, and you've got residents sitting all over the place, and there's been times where sometimes the front door is the only option. I try and facilitate it to where it's not, but sometimes someone distracts me, or I can't, coordinate them, and they go out the front door, and there might be 3, 4, 5 residents sitting there. And I think for a facility like that, where these people know that that's kind of the end game, that's they're here until this will be the last place that they live. I think that's hard to see. You can't miss that. You can miss the funeral home carrying the little baby basket. You can miss that, but when you have a stretcher with a black bag, so that would be one thing. Some funeral homes have very beautiful quilts that they put over, and I think that I love seeing that. I think that was very special. That's a lot easier to see than like a black zippered bag almost. That would be one of the things that I would say, ooh, maybe put the quilt over that bag. But there were a few, and I don't know whether it's just resources or whatnot, but there are a few times where it was just very plain black bag, and I mean, you know what's going on there, I mean, you know what's going on with the quilt too, but it's more comforting. Mm-hmm. It's more comforting to see a beautiful quilt on top of someone than them just going out on a stretcher in a black bag. So I think that's probably the only complaint I would have in regards to the nurse or the funeral home coming and receiving the body. But everything else has been nothing but, helpful and supportive and just super kind people. And if family's there, they are super good at talking with the family and comforting them too. I've never encountered anyone who was like flat effect. They've all been very comforting and nice, so that's a positive thing. But yes, if everyone had quilts, that would be great.